conservative media viewers, what's going on? It's me, John D. Villarreal, and I've got a special presentation for you. But first I have to give the disclaimers. As you know, I'm not a medical professional. I'm not making any kind of medical claims. There's no medical claims in here whatsoever. It's up to you to talk to your own medical professional, make your own decisions. In fact, we're not making any factual allegations whatsoever. This is all my own personal opinion and the opinion of Dr. Jeffrey Miller. And this is all for informational entertainment purposes only. Check the disclaimers, all of them. In addition, we are getting paid for this video. You need to know that, but all these opinions are my own, and this is what I truthfully believe. Now, that being said, let's start on this. I'm excited about this because, as you know, I'm a 4-time national champion powerlifter. You know that. I was national to world class in 3 strength and combat sports, and I met Dr. Miller several years ago. It was actually he was introduced to me by a friend of mine who's also an athlete to help me with my competitions. He went on to sponsor me and help me win my last competitions, my last national championships. And let me tell you something. It really is so critically important. I've seen the difference in myself. I wanted to bring this to you. He's got some new incredible methodologies and technologies that he's bringing together that you might find beneficial. I definitely am someone that has benefited from this, and I think because I was in a situation where I competed at an elite level for 21 years. And you know, you do a lot of sort of damage to your body in that time. I didn't want to be in a situation where I couldn't walk later, where I couldn't do the things I want to do. When I had a family, I couldn't have that kind of you know, fun with my kids and play around as when I was younger. So it was really important to me to say, okay, not only how do I look for someone that can help me compete and win those last national championships at a high level, but also what can I do to sort of repair and heal my body to give it the longevity and sort of try to reverse some of the damage that I've done before. Dr. Miller has helped me do that. I want to introduce you to him, and I want you to hear what he's got going on right here. Let's talk about the spinal decompression. What does that do, and what kind of results have you seen with that?
Well, you know, honestly, spinal decompression by itself has never been that effective of a treatment. What it does is, in combination, it will give us the ability to reduce some of the pressure on some of the loaded structures, so your facet joints and your discs. By itself, there's honestly not that much of an effect. All by itself, if you just did spinal decompression, you probably wouldn't see a lot. And you know, there are some doctors who have tried to do that and made some claims about that, and it doesn't make any sense. It's something that's great to incorporate together, because what it will do, it will unload those structures, allow us to reduce the pressure on those structures, and in combination with the functional neurology, in combination with the deep tissue laser, we can get those structures to heal. But that's just one of the pieces of what we do.
So it's almost like a primer that sets up the other methodologies.
Absolutely. It's something we'll do for those cases that have that type of injury. So, I mean, that's really what we're looking at, is we're looking at trying to find out what is the best possible treatment for the patient. And patients who have disc injuries and patients who have neuropathy, you know, patients who have chronic pain syndromes, reflex sympathetic dystrophy or fibromyalgia, they've had very few options that are effective. You know, they'll get gabapentin, they'll get certain drugs, they'll get certain physical therapy, and if they don't work, they're kind of stuck. You know, and so we're giving them an option, and it's one where if they come in and they're able to see us, and if it's something I think we can treat, they should be able to find out and make a very objective decision. Do I think this is going to work for me? Because if I give them the opinion that I think this is going to work, they should already feel some of the things going on. That's why we do the demonstration treatment, kind of like we did with you the first time.
That's right.
A demonstration treatment to see what the physiological effects are going to be, and it gives the patient the option and the ability to feel, okay, something's going on in there that wasn't going on before, and I can feel a difference. There's some physiological change, and we can see that, and that's why we know, you know, this patient it's going to work on, this patient might not work on. And those patients who it doesn't work on, unfortunately those we may not be able to accept. So that's why we do the treatment the way we do, and that's why we make sure that we only accept those people that are going to have the best results, and we tailor the plans to them.
I think that's fantastic. Talk to me about these other aspects of your practice and how you wrap those in for a custom program.
Absolutely. When we look at, like, for example, neuropathy, a lot of neuropathy patients are going to be diabetic neuropathy, right? That's one of the biggest causes of neuropathy. Well, if we don't look at the nutrition and we don't look at the functional nutritional aspects of that, it's not going to heal properly. So we have to look at diet. We have to stop doing damage. We have to look at certain herbs and nutritional components that will help those nerves heal. And these aren't magic. These aren't voodoo. These are very researched and very published issues. So they're very easy to figure out, but unfortunately I just don't think they're all combined properly. So we take the latest in research. And for those patients with neuropathy, we're going to be using different types of things that will help those nerves heal and potentiate the body so it uses insulin properly and stops damaging the tissue. For disc injuries, we're going to do the same thing. Anti-inflammatories, some natural ones that will help the body heal, as well as certain compounds that are necessary and certain dietary changes that are necessary to reduce the inflammation and allow the body to heal itself best it can so it has the components that it needs going forward. And these are all going to be components that we look at on each individual case.
Okay, and so tell me about like the average person that would come in here, or what kinds of different patients do you typically treat?
Really, we try to focus exclusively on, disc injuries, neuropathies, neurological injuries of various sorts, so like carpal tunnel, chronic migraines, fibromyalgia is something we do deal with, reflex sympathetic dystrophy, disc injuries. Those are the main real focuses of what we do, as well as some acute injuries of the more severe type, severe auto cases, severe sports injuries. That's about all that we do. We'll have the occasional case outside of that of an existing patient that we may see, but typically those are going to be the patients that we will treat.
And tell me about like your athletes and stuff. I know you do a lot with the sports and the athletes. What kind of programs would, if someone's competing or they're done competing or they're getting ready for a competition, what would you offer them?
Well, it's really exciting with the athletes when we can work with them. One of the things we're going to look at is that functional neurology basis. We're going to look at treating whatever injuries they have, trying to get the absolute best function out of them. But also we're going to be looking at, let's balance that nervous system, let's get the balance, the coordination, the timing, the overall function as high as possible. And it's kind of a little bit different from what we would traditionally be doing in our practice because we're mostly dealing with pain, but in so doing we're trying to get the whole system to work better. So the exciting part with athletes is we can actually get the reflexes, the muscle balance, the timing, all the coordination aspects to improve over time. And that's what we're doing with a lot of the athletes. So we're checking them out, we're seeing what works, what doesn't, what's in the absolute best shape and what's not, and we're improving what we can and getting them to their top functional levels.
No, that's fantastic. Is it the case that you've been able to take people that have maybe, I think you mentioned before, tried surgery, it didn't work out for them, or they didn't get the full result that they wanted, or that they were, maybe some folks, they had a bad situation and they are scared of actually having to get that surgery, and you were maybe able to help them out? Have you seen those kind of cases?
We have. We've seen a lot of cases with failed back surgeries. We've seen a lot of cases that have disc injuries that either have appliances or no appliances, meaning they either have hardware inserted in their spine or they have fusions of various sorts. And many of those patients will respond. Now, I would say probably in the aspect of 50 to 60% of our patients are disc cases, and out of those about a little less than half are post-surgical. The other percentage are pre-surgical. And of the post-surgical patients, we have a fair amount of success. Now, I would say overall they're not going to have the same result as someone who hasn't had the hardware and the scar tissue and the damage and all of that going on. But it is something that we can offer them hope when most of the time they're told by their doctors you have to see pain management and you're going to be dealing with this for the rest of your life. And so it's an exciting proposition for us and also for a lot of their doctors. We've been very lucky in the sense that a lot of the physicians are referring to us for their chronic cases. And I see the interest because the other alternative is drugs and long-term pain management, which really isn't that good for anyone. No one wants to be on OxyContin or Duragesic, fentanyl for a long period of time because of the side effects.
Now that's a very important point for people that are thinking about this, that they want to come down here in Danville, your practice where you're at. What would they be looking at in terms of length of treatment and potential results?
Of course, as we've always talked about, everybody's different. So this is not going to be something that is universal in any stretch, and also the patients are always qualified, meaning in the sense that I will examine them and will determine whether or not they're even applicable to what we do.
And you're not making any claims, you're not making any guarantees, this is just your own personal experience of what you see in your practice.
This is just something that I've seen in general. And what I find is most of our patients will make significant recovery within 4 to 6 weeks. Now what I tend to do, because I'm kind of a stickler for percentages, as you know, I'm very focused on outcomes. I like to see what I believe is a reasonable result. So I'll give our patients usually a percentage. So if I accept somebody as a patient, I'll say, okay, in the next 4 to 6 weeks, we should see a result somewhere between, let's say, 30% and 70%. And we hit that goal most of the time, 80% plus of the time we hit that goal. There obviously are failures. Any type of technique isn't going to work on everyone. But we have an amazing success rate with that. And so we've been very lucky, and our patients have had some fantastic results, both pre and post-surgical. But the only thing we can really say is, Most of the people, we'll check them out and we'll determine whether they're eligible. And if they are somebody who has a diagnosis we can treat, we'll find out if they respond well. And at that point, we can give them a direct, this is what it's going to take, but usually in a fairly short period of time. Our treatment plans generally last somewhere between about 8 visits and maybe 20 visits. Very rarely do we go above that, very rarely do we go below that. So it's usually about a 3 to 6 week program. And then following that, they can do home exercise. We can refer them to other people to do long-term treatments. Some of them choose to come in a few times a year for follow-ups, but that's pretty much typically the duration of our whole treatment.
I think that sounds great. So if I'm someone that's interested in this and I live in the California area, or even if I want to fly in, I know you have some folks that I believe have flown in here,
yeah.
or at least have talked about it. And what kinds of plans do you have for people? What kinds of payment options do you have? And how does that work?
Absolutely. Well, when a patient comes in, we're going to give them the tailor-made program. We're going to show them what we want to do, what we think is the most viable option if we accept them as a patient. And that being said, at that point, we'll go over their financial options. We do have some covered with insurance, but generally isn't going to cover everything. Following that, there are some treatment plans. So we have, certain payment options. Obviously, they can always pay according to their plan. They can get the insurance coverage, whatever they have. And then the remainder, we have payment plans that extend it out to 18 months. And so most patients have been able to afford our treatment, although it's a very top of the line, very competitive type of treatment, one of the newest things available. We do make it affordable for most of the patients.
Do people have to pay if they want to come in here for the first consultation?
That's what I was going to just say. Really the best thing that we can do, and what I've chosen to do, is offer a free initial exam, a free initial consultation actually, where they can come in and sit down with me about exactly what's going on. We can look at their history, we can look at some of their examination results, and then if we see that they're a candidate for what we do, or at least we consider them a candidate, we'll do an actual treatment. And we'll look at the physiological response and determine whether or not they're a long-term candidate. At that point, we'll look at their diagnostics, and then we can make some decisions. So we'll do all of that at no charge. So when they come in, we're not going to charge them anything for that, just to sit down with me and find out what's going on. And then following that, we can go over all the financials with them if they are acceptable as a patient, if they have a diagnosis we can treat, and if we choose to accept them as a patient, and if they want to go forward, we can go over all the finances once we know exactly what's going on with them and what's going to be needed for their treatment.